Okay, great. So thank you everyone for taking time to come to our session, Articulating and Mitigating Risks of AI in Health. Today we have actually planned a really exciting agenda for this next 2 hours, and we really hope that you will enjoy all the discussions that we're going to have. To start us off, we're going to have Dr. Jiho Cha, who is a member of parliament from the Korean National Assembly. Let me just introduce Jiho quickly so that you know the great background that he has. Jiho is a member of parliament in the National Assembly of the Republic of Korea, serving on the Committee on Foreign Affairs and Unification. He is actually a physician by training, a global health scholar and field humanitarian. He has worked with marginalized populations in many difficult settings across the world through non-governmental, governmental, international organizations, and academia. So his research interests really lie in global responses to future crises, specifically related to complex humanitarian crises, climate change, human health and mobility, and AI for humanitarian system. I'm sure we're going to hear very exciting points from Jiho. So without further ado, I'm going to invite him on stage.
Thank you so much to invite me to this honorable conference. And as she introduced, I'm the member of the National Assembly of Korea, but my last 20 years of my experience is fully rooted in the humanitarian crisis. And so in the humanitarian crisis, initially as a medical doctor, I try to engage in the patient in the crisis setting, but later as a public health scholars, and then I have provide some health system strengthening program. Later, I integrate with the AI. So academically and as a practitioner, and I'm trying to engage in the both AI in the health system in the humanitarian crisis. And so today, before I jump into our talk in the AI in health, I would like to address the AI health issue in the wider angle, as a kind of partially as a futurist, because the AI in health is not the only for the present issue, but it is the really big issue in the near future. So we need to consider what factors formulate our future, and in that newly formulating our future, how and why we should address AI in healthcare system. So I titled my presentation as a human intelligence and artificial intelligence nexus. I think it is the core characteristic of the AI health in the future, and I would like to address articulating and mitigating health risk in this future intelligence system. So at the beginning, always we should address the social determinants of health, especially in the future. So when I work as a humanitarian practitioner, I always engage in initially in the impact on the health inequality from the crisis. But after I engaged and more engaged in these issues, I found the crisis does not only impact directly on the human health, but it impact largely on our macro level socio-economic political context, from the governance and macroeconomic policies, social policies, and culture and societal value, which will formulate our or individuals the socio-economic position in that society, and also it can impact a lot on the formation of the health system in that context. So when we address the crisis on the impact of the crisis on human health, we should address on the how it indirectly changed our system at large, and then how it can indirectly impact on the social determinants of health, and then finally on the human health. And also health system can be disrupted or totally collapsed, but in that case is how we can recover it. Likewise, artificial intelligence is not only impact on the human health. Artificial intelligence impact a lot on the transformation of our world. and socioeconomic political governance or those kind of system impact a lot by the artificial intelligence. So when we address health in the age of the artificial intelligence, we should address this kind of a large kind of mechanism on the how it can impact on our society, how it can impact on our changing pattern of the social inequality. So my quick question is the three. So what will be our emerging future? What drive our future? And then this factor, how it can change our nature of our social inequality. And then the AI-powered crisis resilience system, if there is something like that, and how it can need to leverage it over the resilience toward this kind of system. So as an initial keynote, we need to see this issue is as large as possible, because those future we feel that it is already here, but the many aggravating future have not happened yet. So I would like to address two emerging future. First, polycrisis, compounding impact of the multiple crises. And then later, I will address AI transformation of our world. So first, emerging future, polycrisis. As you can see, there are many different factors and climate change, pandemic, and global population changes. But my point is that all of this kind of crisis event is compounding and then have a mixed impact on our future society. And also, climate change itself, it does not only mean the heat wave or those kind of thing. It impact a lot on because of it have a cascading impact on our food security and people's movement and etc. So it changed totally on our political economic system of our world. So let's see. This graph is you are familiar with, and the first thing is that the extreme weather event will be the opportunity or chance for the risk for the extreme weather event will be increased not only 20 or 30%, it will increase the 15 or 20%. So my colleague and I, we are calculating risk of the severe drought, which can be happen in the 100 years. Those kind of the drought rate is the extremely high in next decades. And so, and also second characteristic is that those kind of the severe drought or severe flood, which can be impact of our food security or people's livelihood, will be come differently, continent by continent, and depending on the climate scenario. So it means when we have those kind of climate crisis, especially its cascading impact on the food security or those kind of things, and then it can be happen differently in the worldwide. So we should address climate migration, and because the people always adapted the climate change by the movement or large scale migrant, and unfortunately we expect this crime migration will be very severe in the near future, but even though we don't estimate exactly size, magnitude of this crime migration. Also, climate, extreme climate event is always have a conflict nexus. So as you can see, if there is some severe weather event on the specific region, and then there is the food agricultural system will be corrupted or broken, and then it can increase the people's movement. And like some area of the Middle East or West Africa, the power balance in between the ethnic group is a little bit balanced, but in this impact, it changed the balance of the ethnic group power relation, and then there will be increasing risk of the conflict. And also, we know pandemic will be repeated in near future. We all know, and but not many people think this pandemic will be combined with the climate crisis. So on the one hand, there is the climate crisis, food insecurity, and conflict. And then on the other hand, we will have a pandemic worldwide. And what happened? even single pandemic, our global economy instabilized a lot. But in this compounding impact, I'm not sure traditional economic system or political system can be sustainable in these cases. And also, you should consider compounding impact on the aging population. We all know population transition, and especially global north, and there is the more and more lower fertility rate, and especially in South Korea, uh, we are we encounter the world's lowest the fertility rate, birth rate, and but on the other hand, there is the aging population all around the world, and then increasing the number of the increasing size of population, especially in the global south. So it naturally increased the global inequality across the country because the poorest country there is more population, and then the richest country there is a small number. So it naturally increase the global inequality. So I mean those kind of the crisis, compounding impact of the different crises impact a lot on our socio-economic political context, and then finally on our health system and human health. So it will increase the health disparities, and also healthcare system can be instabilized, and then it is hard to kind of observe the kind of the impact of the transnational migration right in large scale. And also it increased a lot, it vulnerability of the economic status or economic instability will be increased a lot. And also we could see the social unrest. In these cases, the sustainable health system development is very difficult. So as a humanitarian practitioner, when I engage in the globally on the different the most marginalized group under crisis, and actually I could not find the answer how to react this. Then I encountered around the 2016 emerging the technology of the AI, and then I totally changed my discipline. Previously, I was the professor in the University of Manchester in the Europe, and then I switched into my job in the AI kind of industry, AI academics in the KAIST in South Korea, and then try to combine these two. And now in the National Assembly, I try to translate into more policy level. So on the other hand, we should consider what is impact of the AI transformation, how it transform our world, how it impact on our social inequality or something like that. So we should address artificial intelligence we should not address the artificial intelligence alone. We should address artificial intelligence and human intelligence nexus. So let's see the first example. So I think new intelligence system, human AI nexus, it impact a lot on the fundamentally on the changing pattern of the inequality in human intelligence system. So we can see global north and south, human intelligence system quality and the quantity of the human intelligence system is different a lot, and without the AI. But I can see for example, in some sub-Saharan African country, the human resource combined with the human intelligence combined with artificial intelligence, and compare it with like Korea, some human resource intelligence combined with the artificial intelligence. Gap in between the two is narrowed than before. So in these cases, we could see the changing population in the global south and north, and combined with the artificial intelligence, will be fundamentally change the pattern of the human intelligence system. So it impacts a lot on the productivity or economic production of each side, and then it can be linked by the digitally connected system. So and then maybe you can see the Korea, for example, in Korea, which are suffering the extremely aging population, and we could think the elderly population and retirement age can be blurred, because likewise the elderly population combined with the artificial intelligence and compare it with the younger generation combined with artificial intelligence, intellectual productivity can be narrow down. And so in these cases, we could see the different kind of the economic production or economic system from the or industrial labor system can be changes. And on the other hand, AI also have some negative impact and high risk on our digitally transformative world. And for example, AI will change the global security level. You know, the AI, there are many efforts on the each competition of each country how to combine AI into the traditional military system. And not many people consider it is hesitated to compare it the nuclear weapon or biochemical weapon. But I could see, I strongly argue that its impact, AI military system, can be equivalent to the nuclear weapon or the biochemical kind of the weapon system. And also it can reduce, as I mentioned, intellectual system in between the global north and south, and it will be narrowed down. And but also it means the non-state like a terrorist group, their scientific knowledge level can be similar or improved a lot with the AI tech. And so it would not be difficult collaborate with the AI to invent kind of another biochemical weapon system. Also, AI in impact a lot on the political system, and because in South Korea we already experienced in recent the martial law, and then our president, current or former president, I cannot say it, but his idea, even or some extreme group, their idea is surrounded by the fake news or misinformation a lot. And so in previous traditional political system, without digital environment, those kind of extreme leadership or extreme group cannot be survived in the democratic election system. But now we can see the lots of the extreme leadership and the extreme group in this polarization of the digital transforming world. And also, so in that case, these two factors constitute our environment of the future. And our artificial intelligence in future system have a risk, but also it can constitute the resilience in response to this global crisis. So in that cases, there is some characteristic of the AI health in the future. First one is we should consider AI health far beyond the service delivery. So in the health system level, as we can see the transformation system. For example, not only for the health service delivery, human resource governance, health information system, and health finance system using the fintech, those kind of things will be totally changed. So one of the poorest country, they lack not only for the financial resource, but also they lack the administrative capacity to cover health finance system or insurance system or those kind of things. But those kind of things can be integrated with the AI and the more precision model, not only for health, precision financing model or insurance model, and then it can cover some kind of newly development health information system or health finance system. And the other one, we should consider contemporary, the AI tech is still limited, but it is evolving very quickly. So we should see the hype cycle of the AI. So in near future, I think artificial general intelligence, especially if at least it is limited in the health sector, will be emerging. So in this conference, we could see the lots of different examples which are developed to provide service delivery for our different kind of disease pattern or those kind of thing. But very near future, within decades, and we could see some kind of general artificial intelligence which can functional in the different disease and the health system function. So this we should consider on the characteristic of the AI health. And also my slight concern on the this kind of transformation is driven by the private actor. So in this conference, lots of the public actor like me, and then we can gather together and then discuss how we can make this AI transformation for the UHC. But problem is that the current AI health, especially foundation model and large scale foundation model, is driven by the two or three major private actors, especially in the China and the Silicon Valleys, in US. So how we can make it in public, or how we can translate those kind of private actor driven transformation for the more USC framework, that can be the very serious difficulty. And also we now it is time to imagine beyond the domestic or national health system, we can think transnational health system. So in the AI perspective, there is some effort to develop the sovereign AI, which link with the sovereignty of the state-specific nation and then AI. But on the other hand, there is effort to make a regional AI. So one single foundation model of AI can cover multiple countries. In that case, the health system can be integrated, or lots of the function of the health system can be integrated with this foundation model, is at least in regional based on the regional AI. And then we should think, like previously, our national health system is so separated and cannot cross the border. But we should think now the new. Sorry, one more minute. Yeah. So we should think how we can build up the transnational health system, at least regional level. And it is, I think, unavoidable because of the climate change or crime migration or etc. So those kind of changes will be very soon. So in the negative kind of the perspective on this, future health system in the digitally transitioning world, and we call it the one AI health or regional AI health. But if it can be monopolized by the one or few kind of private actor, and then we already experienced the pharmaceutical kind of system worldwide, and then we now overcoming those kind of limitation of the global pharmaceutical system. But AI, we are at some crossroad to build up the better UHC model powered by the AI, or we can see the private monopolize those kind of system. So this is my last slide. And so in this sense, we should consider public crisis resilient system on the one hand, and on the other hand, addressing risk for the UHC in AI health system. So what we need is that maybe Ricardo will explain more, anticipatory governance. So not only consider contemporary technology or something like that, but or contemporary the global environment, but we should anticipate at least 10 years the future, and then we can consider those factors and then work into the new governance model for this kind of transition. Without that, we will be very vulnerable and to the global public crisis, and then we lost our great opportunity from the AI health. So today, I think it is origin of the future health system, and we would like to discuss more on this. Thank you so much.
Thank you so much, Jiho. I think that's a lot to unpack there. I really like how you brought us into this mindset of the poly crisis and how the merging of human intelligence and artificial intelligence can actually help us tackle the poly crisis. And I think you brought up really interesting notions, through like transnational health systems, the one AI health. But also, I think you highlighted a lot of challenges that we will face in an AI-powered world. So throughout the session today, I think you guys will sense the tension between the risk and challenges that we will face by using AI, but also the tremendous potential that AI can bring to our health systems. So after a great start to our session, Before we get to the panel discussion, we're going to have a grounding presentation by Dr. Ricardo Baptista Late. So Ricardo is actually our CEO of Health AI, the global agency for responsible AI and health, a nonprofit based in Geneva. He is a Portuguese-Canadian medical doctor trained in infectious disease with extensive experience in global health, health systems, and science-based policy making. So before his term now at Health AI, Ricardo actually served 4 terms as a member of parliament in Portugal on both health and foreign affairs committees. Ricardo is also the founder and president of the Unite Parliamentarians Network for Global Health, a network of current and former policymakers from 110 countries. So Ricardo is going to share with us today why responsible AI actually matters to us and what it takes for us to get there. Thank you.
Thank you so much, Pei-Ling, and good afternoon. Good afternoon? Thank you. We're waking up. It's important that we keep that human connection. We've been just talking about machines and robots for the last few days. We need to do what we do for humans. Don't forget that. That's at the core of everything we do. And I want to ask for another applause for the Chief Scientist of Health AI, Pei-Ling Yap, who is moderating and really put this all together. And also a word of gratitude to our speakers who have joined us online and here. Mona, Raymond, thank you so much. And Magdalena's online and James. But a special words also to my dear friend and a personal hero of mine, I must say, Jiho Shah, as a member of parliament, as a humanitarian, as a medical doctor, as someone who really put the issue of equity, justice and human rights at the core of everything you've done. And more recently, as your country has faced many challenges, we saw you jumping walls to fight for democracy in your own National Assembly. That's pretty impressive. So, why use artificial intelligence? As the CEO of Health AI, I have the privilege as a global agency to walk around the world and to meet with governments, NGOs, with really private sector partners. And, we get a lot of requests. We want to use AI for health. And the first question I ask is, why do you want to use artificial intelligence? And the normal answer I get is, it's because my boss is telling me we have to start using AI, right? Or if you work in government, the minister now says AI is the big thing. But that's the wrong reason. And I want this message to be crystal clear. We need to use AI as a tool, as an enabler to transform society to where we want society to go. AI is not the solution. It is the enabler that will help us get there. And what is the challenge we need to address in health? Well, the problem is we have a broken health model globally. We don't have health systems, we have disease systems. The industrialization of healthcare has created a dogma that the more we treat, the more surgeries we perform, the more hospital visits we have, the more tests we perform on patients, the healthier the population will be. But that dogma is false. What we see is that we are seeing across the board a rise of the costs of healthcare, and putting more money is not leading to better health. On the contrary, we're seeing a rise of the burden of disease in many parts of the world. And of course, this raises the issues of risks of lack of sustainability. And if the system is not sustainable financially, well, universal health coverage comes at risk. When universal health coverage is not possible or available, this leads to a situation where typically the most people in most vulnerable situations are the ones that are left behind. And so a rise of inequalities and inequities and of poverty enter a vicious cycle. A vicious cycle, and more people get sick, more and more people get poor, and we know that poverty is the main driver of disease. So there is a need to break the cycle. And that's what we should be aiming to use AI for. It's how do we reimagine health systems? How do we imagine health and care? How do we imagine well-being in society in the future? And the truth is, when we look at what actually affects our health as individuals, me as a doctor, when I have a patient in front of me, I'm typically looking at 10% of what actually affects the patient, the clinical factors. 30% of what affects our individual health are biological, genetic factors. 60% are what, as Hiro mentioned before, are environmental factors, the exogenous factors, where we live, where we work, what behaviors we decide to do, what we decide to eat, how we decide to drink, if we smoke. And those 60% are typically not taken into account when we are working in a health system. And the truth is, all of these different components of what affects our health represent tons of data, terabytes of data per individual. And so until now, we knew that these determinants of health were actually affecting health, but we didn't have the tool to change health systems because we didn't have a way to deal with these big amounts of data. Artificial intelligence presents this opportunity to all of us. So one of the messages I would like to get through in this session is that we should not use AI to tell us what to do, but start within your ecosystem by deciding where you want to go. And if you know where you want to go, and if the goal is to have a healthier population, lowering the burden of disease, focusing on health and quality of life and well-being, then if that's your end game, then you build back. You design your system and how you can use the transformative power of artificial intelligence to get there. What we are still seeing in many parts of the world is trying to put AI in our previous 20th century models, retrofitting, fitting these new AI tools to insist on the broken analog models of the past. And so actually perpetuating the inequalities and the vicious cycle I mentioned before. So this is an opportunity to refocus and rebuild. But when we look at adoption in artificial intelligence across the world, in reality, no surprise that the technology sector is by far the sector that has adopted faster these technologies for their day-to-day work. Financial sectors too. And if many of us use digital platforms for our banking system, we see how financial services have been transformed by AI. When we look at health, although it's not as bad as other sectors, it's still only at 6%, despite its transformative power. And the question is why? Why are we not seeing a faster uptake of these technologies? We at Health AI conducted a survey to stakeholders, and private sector, public sector, civil society movement, and it's interesting that the most common word we heard back when we asked about AI and health was the word fear. Fear in multiple dimensions. People were afraid of the potential harm artificial intelligence could cause, the potential risks, the potential biases. And so, especially in health, when we know that when something goes wrong, that affects the life of one or many people, those that have the responsibility of managing a health system do not take risks. They want to mitigate risk as much as possible. They want to make sure that the benefits of what is being done clearly outweigh the risks, just like we're doing when we decide to use other technologies like pharmaceutical products or medical devices. And so, if we do not have a governance system in place, as Hiroshima is mentioning, people will be hesitant to adopt artificial intelligence tools at scale. But there are many solutions out there. AI is not something of the future. It is here today. And what we are seeing is a lot of pilots around the world, but we're not seeing the systemic transformation that we want. And so when we look across the value chain, we see from research and development, we all saw how fast we were able to develop a vaccine during the COVID pandemic. We went from 10 years of development to 8-10 months between development and going to market. That was empowered by AI. We see how molecules are being designed with the power of AI to address rare diseases and diseases that are continuously an unmet need, but also in manufacturing and distribution. We're seeing that even across low and middle income countries, how AI is transforming the whole value chain. In population health, when we see predictive analytics helping when we talk about public health interventions, going towards the idea of a personalized population health, where we can actually have an approach that addresses the needs of each citizen, trying to identify people who have health needs before they're even sick, to be able to make sure we're more effective at preventing them, but also in the care setting, in the institutional setting with robotic surgery and so forth. And of course, in monitoring, getting people out of hospitals and clinics, taking care of them wherever they are, and being able to have a personalized approach. And of course, even on the management side, billing, finances, but also managing waiting lists and so forth. But the truth is we're living in an age that we can call the Wild West of AI. And the truth is, in the absence of governance in many parts of the world, of course, there are a few examples, and we'll be discussing some of them here. Raymond Chua here from Singapore is clearly one of them. But in many parts of the world, we are still lacking the governance to address this tremendous challenge. And this is leading to a situation where a lot of the technology is not adopted, as we saw, but also when it is adopted, people are not scaling it the way we should, and we're not assessing if the technology is actually good. A lot of companies are selling amazing products that can have effective impact in our lives, but others are selling products that are not good. And there is no way for the institutions today to distinguish them. And after they buy the products and put them in, and deploy them into their systems, nobody's measuring many times the impact they are having on our lives. And so this is a market that is growing and exploding. We all know that. We're talking about a multi-billion-dollar industry that will explode at almost $500 billion expected market cap in 8 years from now. And when we look at investment is huge across the board. Well, not exactly. It's huge in many countries, but we can see that particularly low and middle income countries are absent from this graph when we look in terms of private investment. But when we think about, well, maybe the states are chipping in and public investment is better. No. Of course, we know that China is very much state-led, but most of the public investment is also within the global north. And of course, we know that China and the US is huge powerhouses and with some in between. When we look at if countries are prepared to deal with AI in terms of their governance structures and so forth, well, the idea, this preparedness index from the IMF is trying to say if the systems in general, not just in health, are prepared to absorb AI to maximize its potential, we see that low and middle income countries once again are left behind. So AI, which has this potential to be one of the greatest equalizers of our time, to help low and middle income countries leapfrog into the future, particularly to leapfrog to health systems that are more effective and less dependent on the shortage of health workers, the truth is we may actually, with the acceleration of artificial intelligence, see a widening of the divide. And the widening of the digital divide leads to a widening of poverty, of inequities. And this is something that we have to be extremely cautious from the start as we are designing new governance models. Because the history of technology has shown us over the last 1,000 years that technology consistently, when presented, is presented as being something capable of making our life better, but almost always it has only led to a greater concentration of wealth and power. For us to avoid that same mistake with artificial intelligence, we have to learn from the good examples of history. And the good examples were the ones when the technology was designed and deployed. It was designed and deployed with the principles of responsibility, of equity at the core of everything we do. And that's extremely important as we are designing the governance model for today and the future. But the truth is, we are facing a highly fragmented regulatory and governance approach. Many countries still have zero to none capacity when it comes to the governance of AI. And many countries that are investing in this space are doing it almost alone. And this is leading to tremendous fragmentation. If you're interested in this topic, Health AI published under the leadership of Pei-Ling Yap's team, this report of mapping AI governance in health that you can download from our website, which is an amazing overview of where we are now, today, in terms of the governance of AI and with some concrete case studies. And there are 5 challenges I would highlight when it comes to the regulations and governance of artificial intelligence. One is the fragmentation. I've already addressed that. The other one is the fast evolving AI. The technology is fast, it's growing, it's changing every day. You know, until December 2022, until ChatGPT became a commercial product, nobody even knew what an LLM was beyond the technologists. Now it's something that we all use. And the adoption was one of the fastest in technology history. And so I was a member of parliament, just like Honorable Cha here, and the truth is we know that if we depend on parliaments to approve all the changes, we will never keep up with technology. We need to empower regulators. They need to have the power and the resources and the capabilities to be able to keep up to speed with the technology if we want to stand a chance. Data security and privacy, of course, are big issues that need to be addressed. Post-market surveillance. It's not just assessing a technology before it gets into the market. After you deploy a technology into the market, you have to make sure that that technology is performing well. It's actually doing what those that developed the technology promised. It's improving outcomes. And finally, health technology assessment. This is one of the biggest challenges governments are facing because especially health systems that have to reimburse technology, how do you determine the fair pricing? How do you determine what to pay for that technology? And if you don't determine the pricing issue, you will not scale the technology so it can have a systemic effect. And so we identified this challenge at Health AI, where in the lack of effective governance leads to the absence of mechanisms to deal with the risks, to mitigate the risks. And so when you don't have that, you don't trust. And when you don't trust someone, you're not going to do anything with them. When you don't trust the technology, you're not going to adopt, right? And so that's an issue we have to address if we want technology to be adopted and to be scaled for systemic transformation, which is our goal at the end of the day, which is to accelerate the adoption of technologies that do improve health outcomes for all. And we looked at some examples from history, and we went all the way back to the 1950s, when this drug was put into the market called thalidomide. This was a drug that was given to pregnant women in unregulated markets. And at the time, it was a drug given, I've never been pregnant, but I saw my wife. You can get pretty nauseous, right? And the idea was to avoid nauseousness and vomiting. And this drug was supposed to help with that. So curiously, it was given especially to upper class women. And what led, sadly, was the tragedy of all it. It led to more than 10,000 babies being born with birth defects, and many more died. The silver lining of this tragedy was that it led to the world saying, we need to agree on how do we avoid this cannot happen again, and never again a moment. And so how are we going to do that? And so a regulatory framework started to be designed to what we today accept as universal. Nobody really in the scientific world challenges the idea of having randomized clinical trials for pharmaceutical products. Nobody challenges the idea of multi-phase processes of evaluating these technologies. Nobody questions that regulators are the gateways to access to market to determine if the technology is safe, quality assured, and effective, and that companies have to go to those regulators to get approval to enter the markets, and there's a post-market surveillance mechanism in place. We need something similar to make sure that we are governing AI to accelerate the adoption of technologies that actually work, and that's the work we're doing at Health AI. And we have an amazing team out of Geneva, but with people around the world. And I just highlight among myself and Pei-Ling within the senior management also our Chief AI Officer, Alberto Buceto, who was the Chief AI Officer at Merck Pharmaceutical, and before that a professor at Santa Barbara, California, and Paul Campbell, our Chief Regulatory Officer, who was the head of AI at the UK regulator at MHRA, and of course, Silvana Liska, who's head of operations, who came from WHO Foundation. And the team is working towards completing our mission as an implementing partner, as a nonprofit implementing partner for governments, who are our key stakeholders, and the ones we actually sign contracts with to work with. And so you can imagine Health AI as this bridge in the middle of the screen, where on the left side of the bridge, you have the normative standard-setting organizations like the WHO, like the OECD, international standards organizations, and so forth, that define standards and guidelines. We do not do that. We work with standards that have been defined by those that have a mandate to do so. On the right side of the bridge, you have the national regulatory bodies. These are the agencies, entities that the government decided will be responsible for assessing AI technologies for health systems. And we help translate and interpret those international standards, and we help adapt them to the local context. And through our implementing work, we are helping governments to build their governance capabilities to be able to assess and validate AI solutions for their health system. So building these validation mechanisms is critical. So the government, as soon as this is put in place, and we're starting with 10 countries this year, those 10 countries will be a mix between high, middle, and low-income countries across the globe. And so they will be able to finalize that, as we will at the end of the year, the technical assistance. In 2026, those countries will start to assess and validate AI solutions for their own health systems, integrated as they will be within a global regulatory network of 10 countries that will expand from those 10 countries beyond. And we will be able to have an early warning system. So basically, if there's an AI tool that any regulator from Singapore to India to Switzerland to Brazil identifies any risk, we will share that information in real time as a red flag to all regulators to avoid further harm, to avoid that harm can hit people at scale. And so even for companies to be able to fix the problems before they become a global phenomenon. We're creating a global repository of AI solutions. As regulators approve the tools, they will appear on this single platform. So we'll be able to see what technologies are out there, who developed them, and which regulators have already assessed and validated them as compliant with responsible AI principles. And we're going to be able to provide advisory support. Finally, we have launched the community of practice. This community, this health AI community of practice brings together governments. We have already 28 governments on board, but also we have private sector partners, we have academia, we have nonprofits, really stakeholders across the board. If you're an institution that works in this field or is interested in it, as an institution, you can apply. There we go. It's time to shut up. You can apply to be part of our community of practice, which already has almost 200 institutions as part of it. And the idea is for us to collectively to discuss the issues of governance, to try to co-create this future together. But most importantly, for us to keep flexible. What we think is right today with the fast evolving of technology will not be right tomorrow. But we need to work together because only together will we be able to work towards a healthier future for all in the future. Thank you so much.
Thanks a lot, Ricardo. So can I invite Jiho and Ricardo to head down and Raymond and Mona to come up? We're going to move into our panel discussion. And we're going to have two of our panelists actually joining us online. And unfortunately, due to travel and visa issues, they were not able to join us here. And I think, yeah, we need a few more mics on the table as well. Good. Right, so I think Ricardo got us all really excited about what the future can hold for us in terms of AI in healthcare. But we also see there's a lot of challenges again to tackle. And I think hopefully through this panel, we can address some of these challenges and also really highlight some of the practical actionable items that regulators, that civil society can be part of to make an AI-powered health system a safe and effective place. So before we start, I just want to introduce to you quickly our panelists. So on my right here, we have Dr. Mona Dugal. Mona is actually an associate professor at the Advanced Eye Center of the Postgraduate Institute of Medical Education and Research in Chandigarh, India. And then we have Raymond, Dr. Raymond Chua, who is the CEO of the Health Sciences Authority of Singapore, as well as the Deputy Director General of Health Regulation Group within the Ministry of Health in Singapore. And online, if we could show our wonderful panelists online, we have Magdalena. She's a postdoctoral researcher at the University of Vienna. She's dialing in from the United States. And James, he's the Chief Advisor of Precision Health for the Ministry of Health in New Zealand. As you all might notice from the agenda, we did invite Stephanie Ifayema as well to join us. Unfortunately, she's quite sick, so I'm not unable to travel and also maintain a virtual presence through a dial-in. So she extends her sincere apologies. But I believe that we have enough content here to really get us all very engaged. I think to get us started, we have talked about the polycrisis, the importance of AI, to be actually safe and effective. I think this brings us to the definition of responsible AI. And I want to turn the floor to Mona to really help us define, when we talk about responsible AI, what do we mean?
Thanks, Willing. I think this is kind of a question that we all delve in. But at the core of this is when we are developing an AI system, it has to be like in align with the societal principles. And when we are actually deploying it, it has to have a good intention. So it is almost like when we are doing the implementation research science, we almost follow this all these principles. So we have to make sure that the responsible AI is kind of the next word in ethics implementation. So it's like when we are developing and deploying, it has to be in a good intention based on the societal values. So I would stop here because I think that is where we need to make that difference, that AI has to resonate with the society, and the ethical principles should be in place, and both at the societal level, whether the people who are the consumers or the patients and people who are applying it. If the consumers are not aware at this point, which we are seeing consistently, the people who are applying it should be well aware of the responsibility.
Thanks a lot, Mona. And I really like how you bring in the community angle, right? Like how actually, when it comes to responsible AI and the ethics behind it, it really truly reflects the society's values. And I think we'll touch more on that as well. And I think ultimately, when we think about responsible AI in health, it's also about making sure that we do no harm. I think that's the ultimate, and also to ensure the promotion of safety and well-being. I know that James is actually from the Ministry of New Zealand, but actually just recently he has moved over from the private sector over to the bright side, let's say. So James, maybe I want you to put your sort of private sector hat on a bit for now, because I think, like what Jiho mentioned in his presentation, innovation is very much private actor driven. And so when we talk about responsible AI, sometimes I feel that it's a very public or academic concept. I just want to get a sense from you, from the private sector perspective, what do they think about this concept of responsible AI? Does it even resonate with them?
Thanks, Pei Ling. So I'm going to talk a little bit about my experience working previously at a US-based company that was developing algorithms in the digital pathology space, specifically for patients that may respond better to certain cancer treatments. And I think my key takeaway is that industry is really wanting to do things responsibly, but the pace of innovation makes it very difficult because outside of product regulation for software as a medical device, there's often very little in terms of ethical or regulatory frameworks in which industry can operate. So they often have to create their own. And in our case, we had to do that too, in my previous role. The team of pathologists really had to sort of define the problem that they were going to solve, start understanding who would be impacted by the tool that they would be using, really undertaking a very rigorous impact assessment and privacy assessment. And through that, we uncovered that actually the images that were being used to train the model were often being sourced from patient photographs of slides where they maybe hadn't consented to the use to be developing an AI algorithm. We had the data for a different purpose, and we were effectively using it for the development of a new product. And so that led us to a really important moment where we developed a dynamic consent process, a dynamic informed consent process, where we could actually reach back out to the patient and make sure that they were consenting to the use of the data to be used for something else. And so I think, the industry is really trying hard to do things responsibly. It can be a little bit of a challenge when these sorts of frameworks don't exist and the pace of innovation is just so quick.
Thanks a lot, James. And I think also being in the genomic profiling field, I agree. I think you will agree that outside of software as a medical device, a lot of areas such as genomic profiling actually doesn't really get much regulation focus, let's say. And then so I think further down the discussion, we will also talk about how not everything has to be regulated, but even if they are not regulated, it should be at least responsible. Well, so it's good to hear that the private sector is actually has the intent to set their own sort of boundaries and standards to ensure that they deliver safe and effective technologies to the people. So that's good to hear. Then maybe let's move on now that we have established what responsible AI means and that we have the buy-in also from the private sector. Now really turning our attention to, again, the risks and challenges of AI and also what it can bring to the society. And Magdalena, I know that you have done a lot of research on that, particularly on the impact that AI has on marginalized communities. So if you could share a bit more on that, that would be great.
Yes, thank you so much, Hailing, and I'm happy to be here. So I think something to consider is, in general, if we consider traditional healthcare technologies, we've always noticed this trend that marginalized communities perhaps have access to new health technologies at a later point or not at all, or the quality of health technology access is not as good as for more research people, and we can think of that on an individual level or even a global level. But what we've really noticed with AI is a difference in kind, in a way, because here we don't just have the access at the end point of the technology that brings up challenges and ethical challenges, but throughout the process. And I think some of the other speakers have touched on this already. We could differentiate as a starting point between internal and external challenges. And the internal discrimination mechanisms that we see are, of course, already in the data, in the way that algorithms are being built. And James, you touched upon the fact that perhaps patients aren't even giving full consent or aren't fully aware of how they give consent. But we also, even if patients do give consent, we have the issue that some groups are just included in the data that's being made. And we see that traditionally marginalized groups perhaps are either overlooked or, because of historical bad experiences in research and in the healthcare system, also are less likely to contribute their data, which is extremely understandable, but at the same time, it means that they are underrepresented in the end product. So already in the making of the data, in the making of AI and algorithms that later go on to make informed decisions for patients, ideally, there's this discriminatory mechanism. And then, of course, if we think about who can actually have access to AI tools, what we're seeing is that a lot of the tools that are being developed at the moment are quite high tech still. They're being used by companies, by research institutes, within hospital contexts. And on a global scale, what would be really needed is very high quality AI tools, but that are a bit lower tech. So, for example, that are able to be used on a smartphone and are easily accessible, and don't require this huge entry point to profit. And the idea would be to also share the benefits a bit broader than what we're seeing at the moment. So maybe we can leave it at that for the starting point, but I'm looking forward to the rest of our discussion.
Mona, you want to say something about the data side?
Yeah, thanks for bringing that up, because I think the way the data is collected overall, I think specifically in the low middle income countries where consent is still an issue, because I think when I was in US, it was inherent, like even if you go to a private practitioner, you have this HIPAA form and the patient is informed about the rights. This is not so in our public health sector or even in the private sector. What we actually say is, like, once a patient comes in, it is a prerogative of the physician, or it's a bracket consent to kind of get the data. So this has been one of the ways how the industry has been able to collect the data. For many of the AI platforms that we have seen being built and deployed in many of the LMICs. So how the consent is taken for the data and how the data is collected, standardized, that is still a huge issue, which we feel that needs to have a lot of input. And maybe the areas, there can be different sources of data, but how it is collected and how the informed consent is given, that can be discussed.
Maybe I'll just jump in. I think as a regulator, when we look at, I think we were talking about informed consent, and I think one of the things that is very important, and I would maybe just like to get a feel of the audience here. when you get an informed consent on your phone, when you subscribe to an app or whatever, how many of you actually look through the consent, or you just scroll, and then tick, I agree, and then you just subscribe to whatever it is. How many of you actually read through the consent? Please put up your hands. Oh.
Wow, we only have 3.
1, 2, well, I would say a handful.
Yes. No, not even a handful, right? Like
Less
fingers.
than a handful.
Yeah.
So you see, I think where we are talking about it is, we always say it's very good to have informed consent. But I think what happens is when we develop an informed consent, from our perspective, we will want to cover all risk. And then the informed consent will be very long, and it becomes very long. Not a lot of people understand what they are subscribing to. So I think when we look at some of these processes, we need to understand what is it at stake or at risk to the patient itself, him or herself is. Do they even understand? I think one of the biggest thing is, especially in the low middle income countries, is the literacy level. We can develop a consent form that is very uniform, but they may not understand what they are subscribing to. I can think, and I can expect that when you go down and tell them what is explainability, transparency, they will look at you and say, I don't understand what is this, and then they were like, okay, just sign, it's very good for your health, and okay, they will just subscribe everything, because ultimately they look at benefits more than risk.
Yeah.
But I think that's where, when we look at some of the processes, and if we really want to implement, we have to balance between giving a lot of information.
Yeah.
Do we need to understand and train the literacy of the public who is actually going to use it? The other thing is not just about public, but ultimately it's also about the healthcare professionals. Yeah. A lot of healthcare professionals, like Ricardo say, why are you subscribing? Because my boss asked me to do it. My boss, asked me to implement this, so I will just implement this. But they don't understand how is the mechanics behind, what is the data that is being used to drive all these AI solutions on the ground.
Yeah, I think you brought up a really good point, and I think ultimately the issue is trust, right? I think the society places a lot of trust in the people who hold the technologies, who hold the knowledge. So for example, when you take a Panadol these days, a paracetamol, you will never question, oh, what am I taking? Is this safe, right? But with AI solutions, we are not there yet. And therefore, we have to build that framework, that ecosystem, to get us to a stage where when people use AI solutions in health, it's as natural as taking a paracetamol when you are sick. So I think that brings us to a good segue. If we don't gain the trust of the public, what would be the consequences, right? Like Raymond, what would be the consequences for you as a health regulator if, the risk that Magdalena talked about, Mona talked about right now, if you don't address it, what will be the consequences for our society?
I think we have heard throughout the whole conference that erosion of trust in the healthcare system, in the AI solutions, would definitely lead to low adoption, in terms of the AI solutions. And I think then it will be a backward in terms of how we are looking at the adoption of the new technologies itself. Often the time, we often find that, people say, do you want regulations or do you want no regulations? Because people may feel that having regulations will impede the innovation. But actually, I take it on the other way around, that having regulatory clarity, in terms of how you think, things should be rolled out, how it should be governed, actually gives you that ability to then adopt the new technologies forward. I think the question is not about how, it's not about the regulations, but it's about how we roll out the innovations. And I think this is where a lot of engagement, which we can talk about it later, will be very essential, in terms of that. So we have to look at the risks to the patient. I think the risk to the healthcare institution who is rolling it out. The other one is, of course, the healthcare professionals who is using the solutions. Ultimately, a lot of healthcare professionals are under their own professional regulations and ethical codes. And if they don't actually do it well, I think that's the other risk to the professional code itself.
Yeah. Raymond, maybe I just want to put you on the spot again. So if you think about sort of using regulations or using mitigation strategies to gain trust, right? What are some of the existing regulations that we already have? I think we all should be aware that even though AI per se doesn't have really proper governance systems, but when it comes to health, a lot of AI solutions will fall under software as a medical device. So we do have existing regulations that target that. But yeah, just a sense from you, what is out there already? What are the existing regulations out there? And what are the gaps we are seeing when it comes to generative AI and predictive AI?
So in terms of regulations, I think we adopt quite a wide range of regulatory tools. I mean, as a regulator, we have a toolbox that we use. I think you mentioned that a lot of AI are actually software as a medical device. So it is governed by the legislation itself. So it is a medical device. But we also find that when you talk about it, when you talk about AI, is being used as a medical device, it is a very silo mentality that you are looking at it as a product. But ultimately, we find that when you looked at the AI being used as a product, it is actually being used by the professional in the service setting itself. And I think that's where we are also looking at trying to see how we can enhance the regulations to bring in the service, the institutional governance that goes around it. Because after a person or an institution has purchased or used or decide to use the AI, it is not just about the product. It is about how you actually use it. Is there a professional code that governs how the professional should be using it properly? Do they actually need to explain properly to the patients? I think a lot of that is lacking at the professional level. The other one is the institution that purchases it. Ultimately must be responsible for the AI. It cannot be just saying that I'm just buying a product and I leave it to the manufacturers. And if there's anything wrong, the liability is on the manufacturers. Ultimately, we must decide that a lot of AI now are not just used in silo. It is actually an augmentation tool. There's still a human in the loop, to be used for AI. And ultimately, to that, there must be a proper governance structure that we want to put in place, for the institution that are using it. Then after that, we talk about there's a lot of data being used to either train or being used to store, the patient setting itself. So there's also the need to ensure data governance itself. So I think we are putting on different layers, of different regulations itself, to actually guide the professionals, to guide the institutions to do it. So these are the different toolkits itself. But we are also saying that, do we want to move on to like EU where you have an AI law, or do we want to use a guideline approach? I think we are also saying that maybe for now, rather than just mandating everything through law, we might want to use a softer kind of regulatory governance structure in which we want to actually come up with guidances to guide and work with the industry as work with the professionals in terms of how we want to roll out the AI use safely.
Yeah, I think this kind of like middle ground approach is really sensible because, I mean, for the innovators in the room, I don't have to say that a lot of people, when they hear the word regulations, they get very scared, right? They are worried that regulations will actually stifle innovation. And I think, James, I'll call on you now, having been on both sides now of the bridge, there is a sense of like, how do we strike a regulatory balance between enabling innovation, yet at the same time having clear regulations or guidelines that can help protect the safety of our citizens? Over to you, James.
Thanks, Pei-Ling. So New Zealand is really in its infancy when it comes to regulation of AI and healthcare. And in many ways, it's actually an opportunity because it means we can probably be a bit of a fast follower. And so our government has signalled very much a light touch, proportionate and risk-based approach to regulation, which is where we're starting. And I think we don't have any regulation for software as a medical device yet. So we're looking at building that at the moment. And that's about striking a balance, right, between keeping patients safe, keeping their data safe, as Raymond talked about, making sure it's not doing any harm, but also not over-regulating so it's stifling innovation. And I want to touch on the concept that you you talked about there, Raymond, around regulatory clarity and certainty. This is super important for industry. We have a number of world-leading companies in New Zealand that are exporting AI solutions offshore, and they are pretty frustrated because they can't really operate easily within New Zealand because there are no regulations. So I think regulation, when it is risk proportionate and appropriate, is really important to give that certainty to industry. And I think that's where you can be very mindful about what you are going to regulate. And obviously things like an autonomous surgical robot is going to need a much higher level of regulation than an automated clinical note-taking app. And I think that's where we're looking at this risk-based approach to regulation.
Thanks a lot, James. And I really hope that, one of the take-homes from this session is really regulation can be a wide spectrum, and it can really ultimately be an enabler of innovation. And I think you see the nod from our regulators here and online. So please make a mental note of that. So one last point I would like to address within our panel discussion before we move to the Q&A so that we can hear from the audience as well, is really the point, I think, Raymond, you talked about it, about engaging diverse stakeholders when it comes to developing your own governance and regulatory processes. So Magdalena, I'd like you to share some examples of your work, how you have been able to engage diverse stakeholders when it comes to educating them on issues related to AI risk and challenges. Magdalena?
Absolutely. Thank you so much. So what I would like to draw on here a little bit is the data solidarity framework, which is a large part of what my research group has been working on. So as previous speakers have mentioned, a huge key component in engaging the public is, of course, generating trust and also finding ways to mitigate harms in cases where trust is broken, for example. And what we've seen here is that there are a couple of mechanisms this could play out. And something important to keep in mind here is that trust in AI can be broken, especially in the context of healthcare, and harms can occur without actually any laws have been violated or broken. And that's what makes it so difficult to also engage with the public, because we have this situation where perhaps no law was broken, but people feel that as individuals or as groups, harm has been done. So I think something to build up that trust and to engage the public more is to think deeply about ways in which harm mitigation can be done. And one idea here would be, for example, to increasingly build up, and we have examples of this being done already, harm mitigation bodies. So these would be independent bodies that would be in place where individuals, but also groups that suspect that a harm occurred with data use in the context of health AI could complain. So the idea would be is that they don't have to hire a lawyer. They could just go to this harm mitigating body, and they could say that even perhaps a secondary data subject, so they were harmed. So not even their own data was harmed, but they suspect that because AI is using such large data sets, that they are perhaps experiencing negative consequences from the data of other people that was used. And there are real life examples of that happening. And we think that this could give the public a bit of trust and encourage them to engage also with the conversations around these topics. And the function of harm mitigating bodies could be that they, of course, investigate cases where harm might have occurred, but at the same time, drawing from other areas of healthcare, like patient advocacy groups, there could be a damage claim system where individuals or groups are compensated for damages that occurred. And there could also be a group fund to pay out to injured parties where a direct malpractice cannot be shown in a court of law, for example. And this could also mitigate some of the harms. And we see this in other areas. So, for example, if patients feel that they have been the victims of malpractice, even if their healthcare workers turned out not to have done anything directly wrong that can be proven in a court of law, but harm still occurred, this body would perhaps support the patients. And the same could be done for harm from data use in AI, for example. So that could be one mechanism, but also, for example, strengthening a whistleblower system. So if you notice that if you're working in a private company, for example, and you see things that are perhaps not a law being broken, but you disagree with a practice, and you feel that the public perhaps would not profit from this practice, you could become a whistleblower and share these practices that you disagree with on a moral level. And I think strengthening these people that are speaking up, that are questioning perhaps practices that perhaps aren't even wrong, but could just be optimized, would be very helpful in fostering an open discussion with the public and engaging the public as well. And overall, I just think we need mechanisms to increase public trust, but also to have, I think trust can only be increased by having an open and honest conversation rather than only focusing on the benefits of AI. And the benefits are, of course, great in healthcare. But I think to build a long-term stable engagement, we need to admit also the disadvantages of AI. And another mechanism of building trust is, of course, very heavily focusing on distributing the benefits equally of AI in healthcare, which is not the case yet, but we hope that this will be done on a broader level in the future.
Thanks a lot, Magdalena. And I think your point on making sure that not just involving the public equitably on the development of regulatory processes, but also about making sure that we distribute the benefits equally among the diverse stakeholders. I think that's really interesting. But going back to these harm mitigation bodies, Raymond, maybe over to you. What do you think of that? Because you mentioned a little bit about like how in Singapore you want to have sort of a one-stop agency that will look at not just products, but also services, AI products, AI services, but probably a bit also on professionals and data. Would like this concept of a harm mitigation body come in useful? How would that look? And what would your public expect from your end? Right?
So I think one development that we are looking at in Singapore is how to bring together different regulatory bodies into one agency itself. And I think currently, I think most of the different countries structure their regulators differently. So services is one, the ministry, the products is one agency, and then somebody that looks at information is another agency, and then another one that looks at professionals. And we are now trying to see how we can bring together, because actually we find that in healthcare, everything is interlinked. The professions are using the products, they are using it in a service setting, and because of digitalization of healthcare, we have also found that a lot of things are now talking about data. So we are now trying to see how we can streamline all the different regulations into one agency, and then after that, trying to see how to provide better guidance to that. And once you have that, I think, it allows us to, I would say, provide much better guidances in terms of how to mitigate the harm, for the professions, when they are using a product in a service setting, so that there's no gaps, within the regulatory setting itself. And I think one of the other things I think Margarita was also talking about is how do you actually bring in the patients and the public? One of the things that I think maybe, and this is something that maybe even Health AI could help to look at, because you are looking at coming out of a global repository of solutions, you are in terms of the global early warning signal,
Yeah.
But a lot of things come from the industry and the
Yes.
professions.
Yes.
But how do you actually involve the public and the patients?
That's a good
Because ultimately, they are the one that are the users.
Exactly.
We are always talking about doctors and industry,
Yeah.
but we have not actually gotten a lot of public and patients into the table as well.
Yeah.
Actually, a good round table to actually hear from the users, of the AI, how they want to have themselves benefit from the system. What information they want, how do they want the professions or the industry to talk to them, would be very important.
Yeah.
Especially now, even when we talk about AI, we are moving away quite a lot beyond just AI that is being used by doctors to now consumer grade AI solutions that the consumers are just using it, to determine whether they have a risk of getting certain diseases. How is that regulated? I think that's something that is also another area that we want to look at as well.
Thanks a lot, Raymond. And Mona, actually, I want to go to you, especially for India, the Indian setting, right? Like, how do you see this kind of processes, taking place? And more importantly, in terms of inclusion of marginalized communities, how do we ensure that they are brought to the table?
Thanks, Feeling. I think Raymond really put it pretty well. I think having a one-stop regulatory, because as we can see, in most of the countries, we still have nobody's talking to each other. So I think the first step would be to having a one regulatory, because I really believe that health is interlinked. And even when we are looking at the systems, we have a public health system and we have a private system. And I've always looked at both the systems because I first worked in the RCH portfolio, and then I have been working in ophthalmology. There are two use cases which have been very different. RCH has been heavily regulated by the government because many governments actually work on it. You have the UN agencies, it's a high priority area. So many of the digital interventions, the whole entire focus on the health systems has been in that area. And but in the ophthalmology, which is a highly privatized area, probably not as important as the RCH in the impact. Many of the things when I look at a lot of industry, Google, Microsoft, they have heavily invested in that, in the eye imaging, and the imaging industry has really evolved. So those kind of examples, I think if the use case examples can be taken and see how they have done, it would be interesting to see. Even in my experience, when we were working in the area of diabetic retinopathy, that was the first study that we did. It was a very interesting example. We had it started off as a project, like an Indo-UK project, where the two prime ministers had signed that AI solutions will be implemented in India. But when it really came to the validation, we didn't really have the local data. The companies then withdrew from that. Then I think our Niti Aayog, which is the highest policy-making body, they asked us to do an evaluation of the Indian systems. They were happily came in. I think we had around 3 systems that came in, and one of the earlier collaborators that had started working, it was an FDA approved. So we had 4 systems at that point. And when we actually tested them, one of them withdrew. The FDA system withdrew because when we validated, it really didn't work in our setting.
That's not
so I think that was the first step.
Yeah.
And as we were going along, we were learning. And the study that we finally then, as a part of this system, we finally wrote to all the companies, can you please share the data? How you collected the data? How did you standardize it? Who annotated it? How did you get to the final call? Believe me, like it really took a lot of effort to get that thing. And half of the companies really did not answer all the questions. So that kind of informed our next step, I think, like getting annotated data sets, standardization, and getting to the public health systems which cater to the marginalized community. And so at this point, I feel that ABDM, that is the Ayushman Bharat, where we have the whole digital thing, digital system set up, we are the most, I think, aligned in that setting where we can do the intervention at that level and reaching out. The other systems will, again, I will agree with Raymond. I think it really requires that the public really needs to be educated. What are their rights? And with the new Data Privacy Act that is coming in, I think it's at the level of both the community and the public and the people who are providing, that they both are sensitized. Not sensitized to the level that they are so scared, but sensitized to the level that they are open to accepting the system and the trust is built. Because we start with a negative connotation. And what happens is that acceptance becomes very low. So there are numerous examples. I think we have, I don't think it's only the AI. If we see vaccination, I've worked in fortification. If we start with a negative connotation, it doesn't help. Let's build the trust, because both industry and we are learning. Industry is far ahead. They already have the responsible AI teams in place and everything, which probably the public sector is lacking, which we are starting to build, but I think we need to learn from the private sector, and I think it has to be a two-way learning. Thank you.
Thanks a lot. Any thoughts from your side, James? Any examples on successful stakeholder engagement from New Zealand?
Yeah, thanks, Pei-Ling. So part of the legislative model in New Zealand calls for public consultation on any proposed legislation. And so previously we have had a Therapeutic Products Act proposed where software as a medical device would be regulated. And I understand there were over 100,000 public submissions to that piece of legislation. So that's part of our process here. And beyond that sort of submissions process, there's an opportunity for government to meet directly with industry, patient groups, create these roundtable events that you mentioned, Raymond, in terms of getting that engagement and getting that patient voice to make sure it's represented in any proposed legislation. So we're doing a little bit of that at the moment in terms of some of that targeted consultation. And we're actually using or thinking about trialing a large language model itself to review some of the submissions, because there's an opportunity for us within the public sector to also deploy AI tools to make our jobs a little bit easier. And this is one area that we're currently investigating at the moment, is whether or not we could actually summarize some of the submissions using a custom-built model for the submissions process. So really exciting to see the public service also starting to adopt some of these technologies as well.
That's really great to hear the positive example from New Zealand. Thanks a lot, James. So we have come to the end of our panel discussion. We'll move on to the Q&A. But before we do that, please give a round of applause to our wonderful panelists, Mona, Raymond, James, and Magdalena. Now I would like to invite Ricardo and Jiho as well on stage, so that you all can ask them questions as well. So anyone, any questions, please go to the mic so that our speakers online can hear you. Maybe we start with this gentleman here. Yeah, go ahead.
So good afternoon. Fantastic presentation and discussion. So I would like to have maybe two comments or questions just relating to the informed consent. So first, I would like to give one. So around 8 years ago, I was in charge for development of the monitoring system for human milk bank. So for some of you might know that these are services that we collect the milk from the mother with surplus milk, process them, and then give to the children in need. So we do have the two informed consent, first from the donor who gave me the milk, and the other one from the recipient, the mother or father of the recipient. So we think that this is very new, and we want to see potentially a lot of good data. So we insert a statement like under the informed consent that we might use some of the data for policy, like project improvement, peer review paper or something like that. So with that statement, actually we could publish more than 10 papers. Most of them are very good journals, like almost all of them are in Q1, and at least 5 of them have impact factor for 4 or more. However, we think that they always ask about informed consent, and we are ready to share with them. So I think in this case, about AI could be one thing, but later on we could use something else. So I think maybe you could just insert that in certain like document, and you could address in the future. Later on could be the AI, or could be something else, and we could still have it. Also, another example. So later I would like to have your feedback about that. Yeah. So another thing also relating to AI, to informed consent is before we just take a picture and then post it in the web or maybe use it in your presentation. So we did that in the past, but in the last several years, our organization have the regulation that you need to have informed consent from the one who took the picture and the one who kind of in the picture. So we need to have really informed consent with them. So with that policy, actually we have to throw out many pictures, and actually that's really waste of resources, because you have to retake it in the individual, and actually it's not action anymore because it should be arranged so that you could have similar picture. So that's going back to the AI experience. So for the thing that's happened in the past, why do we need to go back to get the informed consent? This really wastes resources, right? We are not able to go back to the like medical record like 10 years ago to get informed consent to use for AI. Yeah.
Okay, thanks a lot. Can I urge the other audience to also keep your questions as short as possible and concise as possible? But maybe Raymond or Magdalena, if you guys want to give some brief comments.
So I think you are perfectly spot on in terms of the informed consent. But I think this is where there's always a balance between trying to provide too much information, trying to be very targeted, as well as them making them understand, what the informed consent is all about. But I also like to challenge, the people who are doing some of this is whether you can use AI for AI. Use AI as a way to develop the informed consent. Now we know how AI is looking at. If you actually look at the AI and see whether you can actually do a summarized version. And nowadays people don't like, I find that nowadays people don't really like to read long documents, but they like to hear.
So maybe a TikTok for informed
correct,
consent.
a visual, an audio, in which they can hear or download and look before that. Because there's sometimes that's needed. So you will have to read through, rather than read, make them hear through it and then make sure they understand. Yeah, that's salient points.
And if I can
Go ahead.
insert myself. Thank you so much for the question. And I think you've just made a bunch of important points. But what the question really touched upon, I think this is a question that perhaps is larger than AI even, is if you gather consent, how is it possible to truly gather informed consent for potential future uses that you can't even anticipate yet, right? And in my humble opinion, just putting in one more paragraph in a written document that says, oh, we don't know what we will use your data for in the future, but please sign here. So with any new technology that we'll have in 2050, we'll still be able to access it for practicality reasons, is very difficult, right? But at the same time, I totally agree that, of course, if you have data sets and they're good data sets, and if we generally think that people gave their data up for a reason because they wanted to advance science or they wanted to help other patients or whatever the motivation is, there is a way to perhaps inform people, even for uses that are future uses that you can't anticipate yet. But what I think is needed here is a rethinking of the consent process as it is. And the study that I always like to cite here that really shows how little patients are informed is one in a medical context. It's outside of AI, but they did interviews. Patients were giving some tissue samples because tissue was taken anyway for some sort of surgery. And something like over half of the people, when asked, thought that the tissue they donated was going to another patient that could use it, right? And of course, this was not at all the case. The tissues was being used in labs for testing, for genetic testing, all sorts of things. But the patients thought that they were giving directly to a fellow patient and helping them in one way. And if you think about this is such an extreme case. We really have to think what we're even telling patients, right? And it just shows so much what you just touched on as well, that just giving them a paper to sign is really not enough. Also, if we think about what is really the language level of real life patients out there, a lot of them don't even have the language proficiency to truly understand the document that they're signing, right? So what I would advocate for is a different consent process, to have someone that really sits down with you, talks through it. And yes, we can absolutely use video material to also give patients additional information, but having them sign a dotted line just won't do, and especially with future uses, right? And there's a way and a space to openly communicate. We don't fully know yet how we will use the data in the future, but would you be willing to donate data if it helps advance science or if it can help other patients with a similar disease? And then even if the technology changes, you at least get an honest sense for why the person is donating their data, and if that would perhaps later be in line with the new technology that's developed.
Thanks a lot, Madani.
Yeah, I just wanted to add to these important comments. At Health AI, we're looking at data governance and management to be able to provide blueprints to support regulators. But I tend to agree with Magdalena. Just putting a paragraph won't solve the issue. And I envision a future where people will be able, I think health data will be put on some form of blockchain, and people will be able to self-control the data and how they distribute it. And I do believe that there is so much money behind the data and how it's used that we can actually create incentives to promote a data sharing culture. But also, as a physician, the issue of informed consent is something that always raised some discomfort for me personally, because in most places, if you're going to have a surgery, you have to sign an informed consent, and basically people sign the dotted line without understanding what they're being told. Healthcare workers don't have the time to spend 2 hours, and sometimes don't have the training to adapt the language to different languages, to different cultural settings, and so forth. And actually, I saw an example in Slovenia of a company that developed a robot with a screen on its belly that was the virtual nurse that was going around the hospital. And basically, it's an informed consent nurse. And so this robot would go to a patient who would have surgery the next day and explain in the language and adapt it to the educational level of the person, and if they were a migrant, to their language and so forth, explaining the procedure, showing a video of the procedure, and would stay there 2 hours if necessary, answering to the questions. And only when the patient said, okay, I understand and I'm willing to sign, will the virtual nurse call in a real nurse or a doctor to get the formal consent. And in my home country, there was a study that showed that 60% of patients that left the doctor's office did not understand any of the follow-up recommendations that were given. And I've been with those patients, right? And they say yes to everything, and we repeat it and so forth. But then there is a translational failure. And hopefully AI can help us make sure that we bridge that gap and that we can use it intelligently for that.
Thanks. So maybe we'll take 2 questions from this side.
Please.
Please.
Yes, thank you. I'm Kate Telenko, CEO of Corvus Health, a global health workforce organization. We've talked about a lot of different risks. The risks we haven't talked about is the risk that what actually happened with the introduction of EMRs, electronic medical records, in high-income countries, which was the physician burnout, the early retirement, leaving clinical work, the demoralization, the damage to the physician-patient relationship. These are some of the greatest risks, and we have not even spoken about them. I spoke on this stage yesterday about AI change management with the health workforce. It starts with involving health workers in the decision of what AI is needed, in creation of and testing of those AIs, and proper paid training. As a physician, I've never been paid to do any of the EMR training that I've done. It's always free time on my nights and weekends. And then we need 24-hour, 24/7 support of health workers in the use of the AI. Thanks.
Thanks a lot. So social costs of the AI applications. Over to you.
Thank you. My name is Swapnil. I'm a postdoctoral associate at Boston University and MIT, and I run my nonprofit working on AI and healthcare in India and digital trust globally. Question comes in from the standpoint that in a lot of AI applications, data is kind of transient, dynamic. New data keeps coming in and the application area keeps changing. For healthcare, data moves far more slowly in a lot of clinical applications because your patients, it's not magically that their health is going to shift. So having a distribution of data is really rich for especially private companies who come in and learn more about that. Mm-hmm. In this kind of context, how are we thinking about the carrot and stick for use the data, build good applications, but don't abuse the data because your patients are going to suffer, or like the population that you work with is going to suffer when companies abuse it? And I ask this even as companies have abused this kind of data, with NHS partnering with some tech companies in the UK. And in the US, the DoD archives of data from past soldiers is trying to get activated by tech companies who are saying, have exclusive partnerships with us for 4 years. We won't give the data to anyone else, and we'll help you digitize 50 million tissue samples. So when data is so rich and more static, how do you redefine the carrot and stick model? Because clearly the penalties are not even going to measure the lifetime value of that data to the companies. Thank you.
Thank you. So maybe the first question on social costs. I don't know if Mona, you want to take that, or Jiho?
I think the data management for the future AI system may be transformed. And until now, we use the existing data set and existing traditional healthcare setting. But what I found is that there is the emerging data limitation from especially for the large scale foundation model. There is not many more data can be integrated into the current contemporary model. So what I expected from now on and is that the new data set from the human AI interaction. So previous data set reflect human intelligence output, especially health professional, their diagnosis and their way of the treatment, and then it is reflect into the current data set, and then it is inherited the informed consent of the traditional clinical setting or those kind of thing. But what I expect in next 5 to 10 years, we need to produce new type of the data set. It will be from the human AI interaction. So it is time to imagine what kind of new form of the data regulation from if it is come from the AI and the human interaction, and also the who want this data. So there are lots of the different things can be happen, and also way of the formatting of the new data, so the informed consent or those kind of thing can be also transformed, I think. So I mean this new way of we need a new platform to reflect new AI model, and then it can change our traditional way of the data generation.
Yeah, Swapnil, the question regarding the exclusive contracts, because I think that is happening a lot in India also. And one of the reasons is because probably the people who are allowing it, even in the public sector, do not really understand the implications. So I think that's where the health capacity thing comes in, because you will do, because again, as it was mentioned, it comes from the top. It is about all digital, 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 and people are accepting it without understanding it. And I've seen it in my own institute also, where people say, oh, it's FDA approved, without even understanding what FDA approved means. So the procurement, like we have all these, so it has to have a transformational, it has to start from right through the systems. And even when we are talking about informed consent, it's not the informed consent or anything. The systems have to be now be compliant so that it is safe and reliable, and it has to be implementation. The reach and adoption, what we say, the implementation research principles. So the society can only benefit when your pipelines are kind of there. So if you have to democratize the data, it's not one person's data. If it is anonymized, if it is good, and people have given consent, and people have willingly, with understanding, then I think that is where the future is. But that huge capacity gap that I see across the board, that needs to be taken up, because I think it's a very small community as of now who really understands this risk.
Yeah, and to the Raymond, go.
So just a quick comment about the data part. I think one of the things is to make sure that we take a risk-based approach. So if we are talking about data which are not identifiable, then definitely we should facilitate the sharing. And when it's identifiable, then of course we have to make sure that there's proper safeguards that's been placed within the institution, especially if there's any other sharing, with the industry. Then also the other thing is the environment of sharing. Do you then share it openly with the industry, or do you say that there's a database that only when the industry comes, I'll allow sharing in a protected environment, that you cannot exfiltrate the data out itself? So I think there's different ways of skinning the cat in terms of data regulations. And I think tying back to the training, I think ultimately it's also about how do you make sure that we increase the healthcare professionals' awareness towards data. A lot of healthcare professionals sometimes can be quite laissez-faire in terms of handling data. But I think the question is about, it's always like cybersecurity, data security is just a matter of when and not if. I think it's always like when a hacker will come, and is it just because you're worried about cybersecurity breach, we put everything on hold and you cannot move anything forward? Or we make sure that we train our healthcare professionals to be ready, when something happens, what do you do? I think that is most important itself.
Yeah, if I may also address this question on the health workforce role, and it is true. Digital transformation or digital implementation, I wouldn't say transformation because it didn't change the health system, sadly, led to tremendous burnout, main cause of burnout in the US. It's been proved. And 70% of the time a patient goes to the family doctor in the UK, they're looking to the back of a screen in the doctor's office. While doctors sometimes with 2 fingers are hammering away against a keyboard trying to survive the day. And I went through that phenomenon myself as a physician, where going through that transition and seeing older colleagues that were not digitally prone, not feeling any benefit from all of that effort. Some of them were actually writing on the computer and then repeating in analog writing mode on a pad, right? Because they were not trusting even the technology. So you're absolutely right. The way, and this goes back to my presentation where I said we cannot lose this opportunity to work with AI to transform the system, not to retrofit into the current models, or else we will fail miserably. And all of those problems will just get worse. It'll be the worst nightmare we can imagine. And so, yes, we need to include from the start in that designing, rethinking of what the health system of the future will be, and then going backwards, using AI not as the solution, but as the tool. But it's not just the healthcare workers, I would say. As Raymond said, we also need to include the people, the users of the health system, or the clients, not just the patients, the healthy citizens. Because when a patient feels the need to go to the doctor, we have failed to prevent a disease. And so our end game is making sure that people live long lives, but also healthy lives. They need to reach their elderly age with quality of life. Life needs to be more than surviving. And the way we're seeing the aging population, as he showed with the slides of the demographics as they are evolving, is that people are they're living longer, but they're living very bad, especially among vulnerable populations, and especially among women. And so this is an issue we have to address head on. And this is a huge opportunity to redesign the way we provide, we think of care societally, and including those that are going to provide the care, but also the citizens that ultimately are the ones we serve.
Thanks. So we'll take the last 3 questions, starting from this side.
Stefano Bertozzi from the University of California, Berkeley. Just an initial reaction to the previous discussion. I kind of recoil when you say we need more informed consent, because I feel like I'm flooded with informed consent that's meaningless. And if you tell me that now I need to watch a video to give my informed consent, I'm really going to recoil. I think we need to shift the focus to informed decision-making when there really is a choice. And when you're asking people to make a choice, you inform them for that choice. And that's true whether it's for a treatment or for agreeing to share your data. But my question is, we've spoken a lot about regulation of new technologies. And countries, including New Zealand, may not be doing that yet, but every country regulates providers, whether it's individual providers or clinics and hospitals, et cetera, laboratories. And I'm wondering whether you see that there's a pendulum swinging where at this point, we may be still in the space where for providers, use of AI is seen as a potential risk or liability. If I'm trusting this machine, I might get in trouble if it's wrong, to a situation where I get in trouble because I don't pay attention to what the AI is telling me. Because it seems to me that that pendulum is likely to swing very fast. And I'm just wondering what you see in terms of the regulatory issues at the provider level, and whether you see any evidence that that pendulum might be swinging. Because I expect it to, when it starts to swing really fast. And I can even imagine it in other settings, right? If I crash my car because I'm talking on my cell phone, or even just being stupid, when I could have had auto drive on, et cetera. So I mean, I'm wondering whether you have any sense of that.
Thanks. And this question, we can get Raymond and James to talk about it, but then let's hear from Inke.
Yeah, hi, my name is Inke Mattauer. I'm working with WHO in Geneva in the Department of Health Financing and Economics. And I'm looking at digital technologies, specifically in health financing. We did a few years, well, 2 years ago, a rapid literature review on the use of AI and machine learning, specifically in health financing functions. And we also looked at where this drive is coming from, like who's undertaking these studies or developing these models. And we actually saw that a lot is coming from the private health insurance sector, from commercial private health insurance. Mm-hmm. And so just to give an example of what we have been seeing, there's a South African private health insurance that's using big data, so grocery shopping information, combining it with fitness center visits, combining that with the healthcare visits. And then saying, well, for healthy patients, we give a reward, we give sort of a deduction in your premium. But actually, I mean, factually speaking, it's more penalty for those who have higher health costs and have higher health risks. So in the end, their premium would go up. And so this is in a way the question, I guess, if I'm following your discussions, first, we do actually need quite specific, subsector-specific regulations. So let's say, for example, for the voluntary health insurance industry, it's a bit of a question that I put up to you, like how specific is this regulation going to be? One thing is talking about principles, and we had this early on in the plenary today, but another one is becoming quite concrete. And so it's a real question. I don't really have an answer, but I'm asking you also to the extent, is that feasible? I mean, to what extent should, let's say, voluntary health insurance companies be allowed to use big data and to combine all these different data that's potentially out there? Or should it actually be limited to what they can be using, because they use it to bring down their own costs? They don't necessarily use it, I mean, there's a bit of an assumption behind that, but yeah, they don't necessarily use it to expand coverage. So I'd like to hear about how you think about it. Is it possible, and to what extent would that come into your work? Thank you.
Thank you. The last question, please.
Hane Kim, Right Foundation from Korea. My question is directed to Gio and James, who represent governments. So within your respective governments, I would really like to hear what interministerial, intersectoral efforts are being made to ensure that the most marginalized classes within your respective countries can benefit from the potential of AI. And in Korea, you're probably as familiar with this as I am. Migrant workers represent probably the most marginalized and exploited class in Korea. One of the main drivers for their marginalization is legislation that is permissive of marginalization and exploitation of this group. So I would love to hear what efforts are being made outside innovation and health to address.
Thanks a lot. So we have 3 questions. What I'm going to do is I'm going to do one round. Everybody gets a chance to answer any of the questions you want to. We're going to start with James, Magdalena, and then Jiho onwards. Just keep in mind that we have about 3 minutes left. So if we, Okay. James, over to you.
Thanks, Pei-Ling. I'm actually going to take a stab at that last question regarding marginalized communities. I think New Zealand really is embarking on this, as I said, in its infancy, but we are trying to be as inclusive and sustainable as we can be when it comes to the development of any tool. So we have a public sector framework that was released 3 days ago that guides us around how we should be working across ministries, and the government is currently developing a whole of government approach to an AI strategy, and health will be a pillar of that. We have some really specific needs to engage with our Indigenous communities in New Zealand, and that's actually something that's in legislation that we have to do. And so we are including those things as we start to embark on this journey. So some really important concepts around transparency, explainability, safety, security, accountability. that are going to be used across government to ensure that we are addressing those issues and making sure that this isn't just a tool that only the wealthy, or these are only tools that the wealthy can have access to, then everyone has access to. And I think in a healthcare system like New Zealand, where it's a publicly funded system, that puts us at a little bit of an advantage of being able to do that and ensure that all of the publicly funded solutions are being used by all of society.
Magdalena, go ahead.
Thank you. So I really liked the question about these group associations that you brought up in the context of the insurance system. And this is something that we've noticed overall, like you can use a lot of non-health data, for example, or seemingly non-health data, like where people live or what type of food they buy or so on, to use that, assemble the data, and then deduct on a group level certain types of health behaviors or assumed health behaviors. And you gave this very negative example that's very scary of how insurance premiums could go up, or there could be incentives to live healthier. But maybe to end also on a positive note, ideally we could use this non-health group data in a positive way to build better infrastructures, to see what cities perhaps aren't as walkable as they could be, or where do citizens not have access to fresh foods. So ideally, we would use these group associations, if we use them at all, to make positive changes, and AI could be a huge help with that. So it's not directly healthcare based on group data, but building higher levels of health in society indirectly based on group data.
Thanks, Magdalena. Jiho?
Thank you for your question. And Dr. Hanikim addressed the current problem or limitation of the health system on the existing health disparity, which are inherited in the traditional social inequality. And that is a huge problem. And then also, I think there are different kind of the group of the marginalization, and like the immigrant, especially undocumented migrant workers, and also those who are the socio-economically marginalized with the different region. So in that case, is the AI now South Korea, frankly, is a bit more focused on the how to promote AI industry, and then how to win the AI competition around the world. But maybe Minister of Health or the other organization, and then they have their own effort. But I think we need much more multidisciplinary or cross-ministerial effort on this, because by myself, I also have, before I joining to the National Assembly, I'm humanitarian scholars working on the undocumented migrant workers and also those who are marginalized in this world. But traditional health system modification cannot solve the fundamental structure of those kind of marginalization. And so I think we need another force to transform our society and then make a new direction of those transform power can be one of the fundamental solution. So it's why I focus on the AI. So first thing we need to do is the using AI transformation for not only for the healthcare, but also I call it the AI universal society. So we need to address the better health system to cover to aim for the UHC, but also we should address new AI society should address social determinants of the health. So there are many ways to address this on the, for example, AI universal healthcare service or AI universal income, or there are lots of the different models are emerging, but it should be discussed with more kind of multi-ministerial body. But Korea or the other government does not have it like that. So in Korea, now we are on the very transformative period from the martial law to the impeachment. But next government, one of the key agenda, I think, and I also will to promote is that the new model of the AI society, which can address those how to build up the better kind of the equitable society in terms of health, but also in terms of the socioeconomic status. And also, second thing we need to address is that using AI transformation for the transnational social system. So migration health is not issue for the not only for the inclusive health system on the specific receiving country, but also we should address the whole migration health cycle around the migration flow. And in that case, we need something to far beyond the domestic health system. So it is technologically it was not possible before, but AI induce the health system and then can make a new model. And this is what we aim to do that. But it need more kind of the universal governance model or regulation, and which I also aim to do. And so I take 2 months.
Thanks. So over to Raymond, and please as briefly as possible.
Yes, okay. So I would say back to the regulatory pendulum question, that's something that the regulators always fear. But to me, regulations is like a car, where we will say that we will allow you to accelerate, but there are also brakes in place, which we will make sure that when there's a risk in front, we will have to take the brake, step on the brake, and ensure that there's proper governance, that when a risk happens, you are able to brake. But when there's no risk, you are able to accelerate. I think this is where the regulators will need to balance, in terms of the regulatory approach, in which we will have to understand that with every new technologies that come out, there will be definitely risk that happens. But we must always tell ourselves that we do not, tighten too much, when something happens. We must then analyze what's the issue, analyze what the black box is. If there's an issue with regulatory clarity, make it clearer. Work with the industry to make it clearer. If there's a risk, when there's an abuse by a player that doesn't know that purposefully abuse the regulations, then we make sure that there's stringent regulations and penalties that are put in place. But do not try to just take a knee-jerk reaction and put in too much regulations again, and ensure that we go back to the primitive age again.
Ona?
Yeah, I think I really like the question around the informed consent, and I do agree. It has to be informed decision making. But I do see the point where they say that given how the society is moving, probably it will be again a divide. Like you'll have an aging population where you'll have the doctors and the aging population in one section, where the healthcare providers, maybe it's time to rethink how we actually balance that out. You will have a highly tech-savvy medical students coming in, and you will have a medium, like they will be balancing, and you will have an elderly population and elderly healthcare providers. Maybe it will be a good way to even look at it and how we manage that. But given that how the pendulum is swinging, again, I agree with Raymond. It has to be a balanced view, and the judiciary will probably need to be informed so that they give that informed decision, and the doctors and the healthcare providers are given a fair chance to explain why they did and how they did it.
Thank you.
Yeah, so picking up on this point, the future will depend on our societies. The kids of today, we should be training them to focus on being critical thinkers and innovative thinkers, and most educational systems continue on focusing on mass memorization. And this is a mistake that doesn't lead to more informed decision making. So, the issue you raised, which I think is critical, is when are we going to, in a way, penalize a person for not using AI, a physician for not using AI when treating a patient? I mean, if I have hypertension, I go to the doctor, and they don't measure my arterial pressure, and they say, "You're looking good," right? That's malpractice. If I have an AI tool that is proven to be more effective in detecting early stage breast cancer, and the doctors refuse to use it, I think in the future, if that is a proven cost-effective study, that can be considered malpractice. And so, yes, I do believe that we are going to evolve towards that, because these are tools just like we have so many others in the profession. The other issue that was raised that I want to address quickly is, we all agree on the principles, but will these principles be translated into laws and harsh policies or more guidelines? I think this is a very important question, because that's something we address at Health AI head on. I'm yet to meet a government that says we don't agree with the principles of responsible AI. There are some governments I haven't met, and maybe they don't, but the vast majority, nobody disagrees with the principles of transparency, of equity, of fairness, of accountability, of explainability. The issue that we see differences is how the governments want to implement. That's why we believe very much in our model, which is a checklist-based model, which then each government adapts to their own context and reality. Some want to go further as the European Union with the European law. Others want to have more of a guidance perspective. The importance is that the world is moving in the direction where these principles become the de facto way of working, and that the society is evolving towards these principles. And that is something that I think is realistic, and doing so ground up with leadership at the sovereign level of each nation that then can be united through these kind of networking efforts that we're making, but with strong leadership from ground up. And I think this is a huge lesson after the pandemic, that we don't need international entities telling governments what to do, but on the contrary, we need international bodies to convene and to build that capacity ground up, so that we can make sure that we are more resilient moving forward. Last point that was raised on the insurance premiums, and I'll end here. I told this story a couple days ago at the conference, so forgive me for those who were there, but just an anecdote to end. I was having a call some time ago on Zoom, and the person on the call, the other side, had their phone going back and forth on a swing. And it was distracting me. And I said, why do you have your phone on a swing? I interrupted the meeting. Why do you have your phone on a swing? And the person told me, well, if I do 10,000 steps a day, I get a premium for my insurance. And so, so you can use data collection at the personal level to really incentivize healthier behaviors, maybe. But whenever designing something, make sure that you're thinking of all possibilities. Thank you very much.
Thank you so much. Yeah, so I hope you guys go away with this session understanding the risks and challenges with the use of AI in our healthcare system, but more importantly, how do we mitigate these risks so that we can all proceed further in the future, be more cautiously optimistic, I would say, towards the future. So please join me again to thank our panelists, our speakers, who has,